Mike, welcome. Good to have you here.
Thank you so much for having me.
Yeah, first of all, I would love to hear something about your background, like how and when you decide to become a dentist.
I decided to become a dentist probably back when I was around 20 in college, considering medical school. And a wise parent of a friend said, don't do medical school. The HMOs are going to crap. Try dentistry. So I just followed my dentist around for a day and thought it really matched my personality, getting to know patients. And he seemed to have a great personality and had a fun time at work. And it matched my personality.
And maybe you can share something about your daily life and practice. What does a typical day look like?
Well, I am a general dentist. I own 5 practices, with one of which I see patients in 3.5 days a week. I have 4 kids, so half of my time is working and half is driving kids around.
That sounds fun.
Yes.
And your book is going to be published in the next year, I think.
Next year or so, yeah.
And maybe we can talk a little bit more about your book, like.
Sure. So in my practice, I am about 50% of my patient work is orthodontics, and then 50% is restorative and standard dentistry. What I really love is treating the patients, any patient that's growing or adults. I would say I use about half of my cases are aligners and half are bracket wires, with a lot of functional appliances in the early years for the patients. So I like the growing and developing patient to treat them as well.
And the highlights of the book. So some
Sure.
key facts. Maybe you can share some of
So
them.
the working title right now is exactly what it is, and it should be Foundational Orthodontics for the GP. And it means just that, everything from diagnosis to case selection, for when to refer, and also the how-tos of everything from myofunctional therapy to bracket wire, straight wire appliance, and aligners, and a really step-by-step technique applications as well in the book that I think are really helpful, because so many GPs I talk to do not do a lot of orthodontics. They're happy to place many implants, but for whatever reason they shy away from ortho. And I just think it's such a great service to offer your patients. And as GPs and technology is improving, I think it opens more doors for GPs to do more ortho. But you need to have a good diagnostic foundation. And that's what I hope that this book helps anyone wanting to learn ortho do.
So who else should read your book? Like what audience you're hoping to reach?
Sure, and at our meeting here, I've been talking a lot about this. Who should the audience be? Who would the market be for the book? And I would think really any general dentist that is interested in adding orthodontics to their practice, or just interested in knowing when a patient might require orthodontics, it will work for. But it'll be especially great, I think, for late dental students, dental residents, and brand new dentists. So they have this foundation that, at least in the US, we just don't get a lot of orthodontic education in standard dental school, like at all.
And what else would you like people to know about your work as a dentist?
It's a good question. I guess that I always love helping dentists grow their practices, and I love meeting with dentists and workshopping and doing. I'm very passionate about implementation of the processes as well. So at some point I'll have training for not only dentists but for assistants. So ortho is so assistant driven. That's another reason why I think dentists go to implants versus orthodontics, because they do most of the work, whereas with orthodontics, the assistants are doing a lot of the hands-on work.
And what advice would you give, like, for students or people who consider a career in dentistry?
And if there's people who are just considering becoming a dentist, I would say, even though the student debt is crazy, I would still say go for it. It's a wonderful profession, and there's a lot of really good options for a career.
And finally, what or who are you looking forward to see on IDS?
Well, at IDS, I was much looking forward to meeting with my EDRA publishers because they are always a blast. And the group I'm with, Channel 3, are just like old friends that I've only known for a couple of years, but they're the best people in dentistry.
So thank you so much for your time. It was a pleasure meeting you.
Thank you for having me. Very nice meeting you.
Thanks.